Hello everybody, Dr. Aldin, CEO and founder of Pronto Care. We're going to have a beautiful way to communicate and educate our audience as well as patients and anyone interested learning about heart disease and its management and how to be really empowered as a patient, as a consumer of healthcare through Pronto Care website. So this we're going to start off with the coronary artery disease series, and that's because it's the most common. We're talking about 18.2 million in the United States alone, and that's almost 6.8% of the population who have coronary disease. And what is it, doc? Well, it's the if you will take a journey and take a look into the inside of the arteries. We see a plaque buildup. When we're born, it's all clean and there's no plaque buildup. But then, due to bad dietary habits, sometimes genetics, sometimes other factors, which we'll talk about, risk factors of coronary disease, that really have to go in and play into the picture, and that leads to build up of a plaque. We're talking about hypertension, high blood pressure, cholesterol, high cholesterol, high triglycerides, diabetes, smoking, sedentary lifestyle, and again, hereditary factors all play in this plaque buildup over the years. And what does it do, doc? Well, it leads to symptoms like chest pain, shortness of breath. Shortness of breath, most common in diabetics and females, and it's usually effort related. It comes with effort and stops with rest, and it comes back, and so on. Sometimes it happened with heavy meal. Sometimes it happened with intimate relationships. Sometimes it happened at rest. And if it doesn't happen at rest, then it's an indicator of red flag, and that should prompt ER visit because it could lead to heart attack and so on, which we call unstable angina. The Is it preventable, doc? Yes, for the most part, it is preventable when we identify those risk factors and we work on them. If we control those risk factors, we could get the blood pressure under control, get diabetes control, get the cholesterol or triglycerides, numbers down by diet and exercise, as well as getting medications on board, whatever it is to get the goal of lowering those medications, and we'll talk about it in a separate, topic series related to that. But if we get that, eat healthy food that does not have rich in high cholesterol and triglycerides, that will lead to clogging up, and then also get rid of bad habits, smoking, hookah, and any types of vaping. All that will lead to heart disease. So if we can combine that all together, that would be like 95% prevention right then and there. And then we look into the testing part, where we can go from stress test to nuclear stress test for a new technology called CT angio, which replace cardiac cath in some instances. And then if we have to, we go inside with an invasive procedure called diagnostic cardiac catheterization, look into the coronary arteries, see how bad the blockage is, and then plan a therapy plan. Would it be angioplasty or stent? Put a stent and stretch the artery open, and put a scaffold to keep the artery open, or and if there's too much blockages, then you need bypass surgery, and that requires some time. The bottom line is you're going to need to change the lifestyle, control risk factors, and live a healthy style to get rid of bad habits, no matter what. The medications, though, we have important medications, including aspirin, cholesterol lowering medicine, blood pressure lowering medications, and also a medication that will prevent the heart from getting dilated and change the geometry to prevent any progression to heart failure, which could be a consequence of heart disease. I hope that this give you at least a good start to understand coronary artery disease, to be aware, and to share this with all your friends and families in the community. Please, hopefully, like that video. Hit like and subscribe to our channel, Pronto Care, and hopefully stay tuned for next series of educational topics on heart disease. Thank you.